Hello, everyone. I'm Dr. Howard Gluss, and I'm here for the third webinar in our Psychology and Weight Loss series. We're here at the Kalili Center. We are a multidisciplinary weight loss and surgical center located in Beverly Hills, California. We're very excited to present the third in this series. Today's webinar will be on the concept of food addiction and trigger foods. I wanted to tell everyone that if you have any questions, feel free to send them in. Also, people have been asking us if they can ask questions to me regarding some of our previous webinars, and absolutely you can. What you can do is go to our Facebook page and type in the questions there, and I will respond to you. So, as I said, I'm very excited to present this talk on the concept of food addiction and trigger foods. And when I was thinking about it and thinking of my patients, I was trying to conceptualize what makes the difference between a food addiction and someone who just tends to overeat a lot. And what came to mind was a patient that I worked with for a long time, and this will illustrate what an addiction will feel like. So this gentleman, his name, we'll call him Mark, was with me for a very long time. And what he would describe when he was in this compulsive act of overeating was that he lost control. He would go into this depersonalized state and he'd start binge eating. And he would do that when he was usually in some sort of emotional state or very, and he was unable to basically control himself. It's like he lost thought, and that compulsive eating just went on and on and on and on. And a lot of times it went on to the place where he would pass out from overeating too much and almost vomit at times. He would report that too. And then he would find himself coming to a place where he would start to not feel well. But at first, when he started eating a lot, he would have this high. And it was like a high that someone has when they're on drugs. And what it reminded me of was a study I read through Yale University, that when people tend to overeat a lot, especially around foods that are high in salt, fat, and sugar, there can be an overproduction of dopamine, which is similar to someone who is using cocaine or other types of drugs that would make them high. The increase in dopamine adds a lot of pleasure. So in some ways, the overuse of food and the overeating of food can cause a similar type of reaction. So people, when they tend to overeat a great deal, can experience a lot of pleasure, but then there's a downside to it, just like somebody who uses too much drugs, and then what happens is they have to eat more in order to keep themselves high. They have to do more drugs in order to keep themselves high. And that's exactly what my patient would report. And that's what made me feel like this experience of food addiction is a little bit different than somebody who is just eating a great deal and overeating at times. This was much more of a compulsive act. And also there were trigger foods involved, which is part of our presentation today. And those were foods that usually were high in fat, salt, and sugar. And for him, the food of choice was pizza. This was something that he said would get him high. He'd almost say, instead of using any cocaine, I would just literally order a couple of pizzas and eat till I felt like I get high, and then I would crash. Interesting concept for us to talk further as we get more into this webinar. So my thought around the idea of food addiction was with this concept that there are really 7 principles of food addiction that I've witnessed through my own private practice and my work at the Kalili Center, the bariatric center, where I work and do support groups, and also provide some of the psychological services. And the first concept I wanted to discuss was this concept of emotional pain. That people that tend to be addicted to food will eat in order to deal with some emotional pain, because the food will give them a sense of fullness. The food will give them a sense of minimizing their anxiety and allowing them to feel calmer a lot of times. What a lot of these patients reported is this sense of emptiness when they're experiencing emotional pain. And as I started to think about it, I thought really there are three levels or three concepts around emotional pain that I thought of in regards to emptiness. One was the emptiness of attachment. What that means is, for some people, the ability to attach to another human being, the ability to have an intimate relationship, even if it's a professional relationship, is very difficult for them. And that may happen because of poor attachments to their primary caregivers when they were growing up, attachments that were filled with a lot of anxiety. Maybe there was a mother who was severely depressed, who was unable to attach to her child, and through the years, the child never really formed an ability to create a great bond with someone else. So that kind of lack of attachment can create a lot of anxiety that can be interpreted in some ways as a form of emptiness. So in order to deal with that sense of emptiness and the emotional pain, there are many people that will use food literally to fill themselves up, both emotionally and to fill themselves up literally, like physically. So that's the sense of emptiness due to attachment. There's also an emptiness that I've noticed over the years, an emptiness due to a lack of self. What I mean by that is there are a certain group of people that have developed over time, and they don't have a strong sense of who they are because a lot of their development, their sense of self, was a reactive sense of self. In other words, they were kids that felt they always had to please their parent. So whatever they felt at the time was a reaction to please their parents. So they developed a strong false sense of self, but not a strong true sense of self, who they really were. So when they're not having that person to react against, again, they may experience a sense of depression, a sense of emptiness. And again, in order to deal with that emotional pain, they may go to food as a way of handling those very, very difficult states. Now, there are a lot of types of emptiness people can experience, but one more I wanted to mention in this webinar was what I call the emptiness of transition. I notice this a lot in people I've worked with over the years who have gone through long-term therapy. They may just evolve to a place where they've worked through a lot of the primary issues that brought them into therapy. And then there's a shift. It's a slow shift, as everyone always says. Therapy is always a very slow process. And how do I know when I'm over something, Dr. Gluss? And I always say, well, you'll know you'll be over something when you basically stop talking about it. And then you go, wow, I haven't talked about that person for a very long time. Then you know there's some sort of resolution. So, but as you go through that process of transition and you're forming a new sense of self and you're evolving, you might start to experience a sense of emptiness. In other words, you're not the person that you were before, and you're not the sense of the person that you're going to be in the future, but you're not quite sure who that person is or what it's going to be. It's like somebody, when you were a kid, you used to color and you draw the outside of a picture and then you shade in the middle of it in order to give it a full sense of color. That's sort of what the sense of building oneself is. You have a concept of it, but all the intricacies of who you are need to develop over time, and there's shades involved, etc., but you don't have that strong sense yet. So in those transitional periods, you can experience a lot of anxiety, and you may want to actually regress during those times to go back to a sense of who you were. But, and that's a lot of times why people self-destruct, because they can't really feel solid in who they're going to be. But even though who they were can be very painful at times, at least it's something they recognize. So they want to be able to feel, sort of get a sense of who they are. So during these critical times, during these apologies, we had just a little technical difficulties, but I'm just going to get back to where I was. So during these critical times, what's important to remember is that as you experience a lot of anxiety, you may want to go to food as a way of managing that kind of almost addictive experience of wanting to feel better. But food in excess is not the best choice. And at the end of the webinar, we'll go back to what some better choices might be. I'll definitely try to give you some advice of how to handle these situations in a more productive way. So that was the concept of emotional pain. Another concept to think about in an addictive form of using food is that it tends to be a compulsive-like act. People who report having a food addiction, which is becoming more and more of a sort of a concept that clinicians are dealing with and understanding, that's very similar to a drug addiction, talk about this compulsive act that they can't stop, they literally cannot stop eating, that the sense of thought and rational thinking leaves them and all they're acting on is emotion. So if you're experiencing that, you may have the sense that maybe there is a sense of addiction where it comes to food. Obviously, one of the best ways to deal with it is to help you find ways to put thought process into it in order to stop yourself, in order to calm yourself down enough that you can actually think through the process of the addiction and be able to get to a place where you're calm enough so you're not acting in a very compulsive way. A third concept as we think about these 7 principles of addiction is sublimation. What the word sublimation refers to is that when we can't get satisfied in a certain way, we may use something else to help satisfy us. I'm reminded of a woman I'm currently working with, and she always makes this joke. She always says, like, Saturday night come on. Sometimes if I really want to act crazy and wild, I'll get Ben and Jerry and have a threesome. And even though it's very funny at the time, what she is really saying is that her feelings of loneliness and her feelings of possible depression over not having someone in her life are sublimated through the use of food. Then what happens is, as she starts eating, sometimes she says she goes into this place where she starts getting really depressed, and in order to deal with that, she starts eating more and more, so it becomes this vicious cycle. That is an indicator that there could be an addiction going on. You tend to sublimate with some other product, and sometimes people have dual ways of being addicted, like you may use alcohol and food as a way of sublimating some very difficult and painful feelings. Some people can even have, get into abusive type of relationships where they're stuck to the abusive type of relationship because it keeps them in a certain place. And even though the relationship is abusive, it stops them from dealing with some of the bigger and deeper issues that they may need to deal with, but obviously are too painful. A fourth concept to think about is the concept of trigger foods. Trigger foods are analogous to a drug, in my opinion. So for instance, some people who have drug addictions, their drug of choice may be speed or cocaine, something that speeds them up in order to make them feel better. Other people may use marijuana in an addictive way in order to calm themselves down as a way of feeling better, depending what issues going on for you, the drug of choice. Food can be used the exact same way in an addictive manner. And usually people who have a food addiction will usually have trigger foods that will cause them to go into this addictive state. As I mentioned earlier on in the webinar, my patient, Mark, he used pizza. That was his trigger food that caused him to go into an addictive cycle. Other people may use ice cream. Other people may use, one of my patients talked about his love affair with French fries. Usually it's going to be a food that's, again, high in salt, fat, or sugar, because those are the foods that are going to have produce more dopamine in the brain and are going to cause more pleasure. Rarely do I hear of someone say, oh, Dr. Gluss, my trigger food is steamed broccoli. And I'll always say, yeah, it could be steamed broccoli, but maybe with ranch dressing on the side. So you have to be aware of what your trigger foods are, and you have to go into a state of abstinence with those trigger foods, the same way somebody who's drug addicted will abstain from using their substance. So if you're an alcoholic, you may decide to, usually the best way to go about it is to completely abstain from the use of alcohol, because if you use it, it will trigger some other feelings and possibly a certain physiological reaction that will just be a snowball effect, and you're going to start using a lot more. The next concept I thought about when I was thinking of these 7 principles of food addiction was the concept of what I call abuse pain. It's similar to the concept of emotional pain, but I have found that a lot of people who have had a history of abuse, whether it's physical, emotional, sexual, or abuse due to neglect, and usually it's a combination of several of those, will tend to use food as a way of dealing with those difficult feelings, because food gives us a sense of comfort. It gives us a sense of warmth. They'll always talk about comfort foods during those periods, foods that are rich and savory, something that helps us feel grounded. A lot of times a sense of abuse can be dealt with in those ways. So it's sort of an abusive, what I call abuse pain. And abuse pain a lot of times can lead to a food addiction. The 6th principle I was thinking about when I was thinking about this webinar was the principle of rebellion. I worked with, and I still work with her, this woman, for a long time. She was a model, very successful model, and and now she's not modeling anymore, she's older, but during her periods at her height of her modeling career, she said she barely could not eat, of course, because of the demands made on her physically. But she craved certain foods a great deal, and she was always told that she couldn't eat these foods. So now, fast forward, as she's retired and doing other things in her life, she's just going, well, I'm just going to eat whatever I want, as much as I want, and I'm going to not allow myself to stop if I don't want to. There's a sense almost of a child rebelling over a period that was very restrictive. So food represents a sense of freedom for her. So now she'll go and she'll eat as much as she wants. And unfortunately, it's causing her to gain a lot of weight. But when she tries to lose some weight and stop sort of that compulsive addictive behavior, there's still some repressed anger over how she had to restrict herself so much, even though she understood that it was part of her requirements of being a model. It was still so restrictive on her that it's almost as though she's in this adolescent rebellious state when it comes to food. And food for her represents a sense of freedom. So it also represents, interestingly enough, a sense of self, that she feels like when she is eating whatever she wants, she feels more of herself, because the part of herself that really wanted to eat was so repressed for so many years that now that she's free, she doesn't have to repress herself so much. In an interesting way, it's giving her a strong sense of who she is, but on the destructive side, it's causing her to gain a lot of weight. So we have to work through that. We're in that process of working through of some of her anger and rage over the period of when she was restricted, so she can get to a place where there is sort of a less anger-related food type of eating and a less sense of rebellion. And the last concept I wanted to talk about when it comes to these 7 principles is that when it comes to addiction, there is usually a cycle of addiction that is a little bit different than somebody who tends to overeat. So how the cycle usually works is someone's going along, their life is kind of normal, everything's kind of fine, and they're doing their daily work, and then something happens that causes them to be very upset. Maybe it's usually something that's very disappointing, or even a very traumatic event like the loss of a job. But there's this break in the reality at the present, And then that causes a lot of anxiety and a lot of very powerful emotions that can be very upsetting for someone. And they start to depersonalize, they start being unable to sort of have a sense of themselves, and a lot of anxiety or rage starts to happen. So what happens is you'll want to go and you'll want to create a sense of equilibrium inside of yourself. So you may go, like some people tend to go to alcohol or cocaine or other type of drugs to make themselves feel better. Some people will choose food because it gives them a sense of grounding, it gives them a sense of connection, and it gives them a sense of alleviating some of the anxiety. But given how much anxiety they're under will a lot of times depend how much food they'll want to use during that time. That's the addictive quality. So food is used to soothe yourself in this cycle. Then a period will happen, and it could be, for some people this can all happen in a few hours. Some people this can go on for days. This is why people will call it a binge type of effect, that they may just binge for days because they're still in that process of trying to sort of put themselves back together, like the old Humpty Dumpty nursery rhyme. On some level, they fell apart, and now they're trying to put themselves back together. And then all the defenses will come up in order to make yourself feel better. Maybe you'll use humor, maybe you'll use other forms of natural defenses to try to make yourself feel better. But that's in the process of healing oneself and coming to the other side. Now, here's where it gets interesting for me, and what I've observed is what makes it a cycle is the person will try to go back and build themselves up in a defensive manner and maybe in a narcissistic way to make themselves feel good about themselves and feel whole again, but they don't quite deal with the underlying issues. So what happens is they get back to the state that they were at, but it causes them to move on and to really deal with the feeling. All they've done is sort of built themselves back up again in a somewhat artificial way. So they're still really vulnerable to any kind of upset that will put them back into the cycle. To change that cycle and to get to a different place, what they would have to do is stop for a moment and really find a way to deal with the underlying emotions and feelings that caused you to get to that caused that great upset. Usually you have to spend some time and process through that. If you don't, you may make yourself vulnerable to a reactivation of the cycle. So obviously what I want to say is there is just an enormous amount of literature and insight that is available into the concept of food addiction. I just wanted to highlight some of what I call 7 principles that I've noticed in my own clinical practice that seem to be attributes that a lot of people have when they're dealing with a food addiction and they're dealing with trigger foods. What I would advise anyone who is thinking that they may have a food addiction or difficulty with that issue is to get the professional help that they need to get. So here's 4 thoughts I've had about how someone could deal with this addiction in a more productive manner. So yes, as I just mentioned, get the professional help that you need to get. There's so many people out there that are dealing with this issue. And if there's some shame around it, probably recognize that the person who's sitting across the table that may be giving you the professional help has been on the other side of the table or the other side of the couch at some point in their lives and can really empathize with what you're experiencing. So if there's any shame involved, maybe you have to find a way to negotiate yourself around that shame and recognize that everybody is human and everybody has issues that they have to deal with. And chances are that the person that you're projecting that's sitting across the table that you think may be judging you is probably doing the opposite. They probably understand you a great deal and understand that have great empathy towards what you're experiencing. Whether or not they directly have a food addiction or not, they've probably dealt with similar like behaviors. So, and somebody, I was always told when I was an intern that the more you can evolve in your own life, the more you can take patients through that journey. So understand that usually someone who's a professional will not be judging you, but has probably been through a similar type of experience. And can help you a great deal because they understand it. Learn to also replace trigger foods with healthy foods. Now, I know that's a process because these trigger foods are, our go-to foods when we're feeling bad about ourselves. And they can be high, as I've said, in salt, sugar, and fat. So you may want to start evolving out of them. So let's say, for instance, we'll use pizza since that seems to be my food of choice and the food of choice for a lot of people. Let's say your trigger food is pizza and you want to move away from that. So maybe you start eating a healthier version of pizza. There are gluten pizzas around. There are some choices around pizza in frozen food sections of some health food stores, and even some pizza restaurants are starting to offer healthier versions. So that can move you in the direction of letting go of that addiction towards pizza. You start getting healthier versions, and then maybe you start dealing with a quantity. Maybe instead of eating a whole pizza, you eat a slice of pizza, and that moves, and you get used to that. So you're progressively moving to that place where you might eventually get to that place where you can just let go of it because you're starting to feel better about yourself, your body's starting to respond better, and then your body may crave healthier choices that can move you away from those trigger foods. So the evolution away from trigger foods is, as I said, pretty much an evolution. For a lot of people, that's the best way to go. Cold turkey, a lot of times, is very difficult. So that's a way to learn to love these healthier foods as you start noticing how they make you feel, and you start feeling better. And you start recognizing that those foods that I thought I used to love, I don't really love them anymore. And that goes along with the concept of a new sense of self. So as your new sense of self starts to develop, also your new sense of what kind of foods will make you feel good, not foods that will hurt you, will make you feel better about yourself. Don't be afraid to deal with the emotional pain of what you're dealing with. Think of it as the metaphor of physical pain. That emotional pain will leave the way physical pain a lot of times leaves. If you've had an accident, or even if you've had something serious like surgery, you may have a lot of physical pain involved, and eventually you heal from that. But at the time of the pain, you're experiencing it to such a great extent that you feel that it's never going to get better. Emotional pain is the same kind of process. It's the same kind of experience. If you get the professional help that you need, or there are many ways of going about it, you might be able to move away and process through that emotional pain. And it's not necessarily that you never experience it anymore, but you're not as reactive to it, and maybe the intensity of it, you don't experience it on the intensity level that you used to. And also, you start developing an ability to have some free will around the experience, so you're not as reactive. You can actually think through the experience. And a final thought in getting and helping us deal with food addiction is the idea of support. I mentioned that about getting a therapist. I would also say that one of the things people tend to do around food when they're in an addictive state is they tend to isolate themselves, because a lot of times there's just a lot of shame and embarrassment over what's going on in their lives and the fact that they're overeating or being compulsive about their food. So isolation tends to be a big part of it. What I would recommend is you find the support that you need to find in order to minimize that isolation. Like, for instance, at the Kalili Center, our bariatric and surgical multidisciplinary center, we offer some free support groups that help people deal with issues of obesity. A lot of times, a lot of our patients are either considering or recently had weight loss surgery, so they're trying to get support and understanding the process. And just being able to reach out to someone and hear that they're having a similar experience to you, and being able to understand that you're not alone, can be such a powerful experience. Some of the people who come to our group say, they don't really talk much, but just the process of sitting there becomes such a powerful experience for them that they just think the support is just so important. And the support also offers education. So I would highly recommend that, because you want to go against your natural tendency to isolate yourself. So with that, that completes a certain section of our webinar as far as the material I wanted to present. I already see there's some questions coming up, but I wanted to, let me take those questions, and then I'm going to sort of cap it off with a little summary. But what I like to do with the questions, instead of reading them verbatim, is just to paraphrase them and get the sense of what someone's trying to express. Well, the first question is about someone who's concerned that they may have a dual addiction. They stated that they recently entered an AA program, and they're being very successful. The person's name is Selena. She's from she's from LA, and she said she recently entered this, AA, and she's trying to get clean and sober. But what she notices is that she's starting to overeat as a form of dealing with some of the addictive qualities of not being able to drink anymore. And she asked me, one, is this common? And two, what could she possibly do about it? The first thing I want to say to Selena is, yes, of course this is common. This happens so many times that somebody replaces one addiction for another. So the fact that you're sober, congratulations, that's really wonderful to hear that you're not drinking right now, but you don't want to replace it with another addiction like a food addiction. What I would recommend is, first of all, it sounds like you're in a program, is talk to the people who are in the program and talk to the people who are running the program and speak to them about the struggles that are happening. I'm sure they're trained in how to deal with it, and they can help you find some strategies. So the first strategy is don't keep it a secret, which obviously you have, and other people. What I would recommend more than anything is finding a way to deal with the underlying feelings that are causing you to behave in an addictive manner. The addiction can be an externalization of a lot of internal feelings of distress, and it's a way of managing it. The more you can learn to deal with it in an internal way and not externalize the way you deal with managing some difficult behavior, the more you'll be able to move away from that whole addictive cycle. So create a structure where you can, whether it's through a therapist or in the program they're in, to move away from that addictive-like behavior, and make a list of what your trigger foods are and stay away from them the way you would stay away from alcohol. So stay away from the trigger foods and find a way to process through the difficult feelings. That's a start, because and go abstinent with those foods. That's what I would recommend. I have another question here, and his name is Albert, and he's from the San Fernando Valley, from Studio City, and he's not, it's very interesting. He said he's not clear between what the difference is between overeating and having a food addiction. And I think that's a wonderful question. So if you notice in what we talked about with a food addiction, you'll tend to have this feeling of compulsive behavior, a change in behavior, an inability to control your behavior. And it's repetitive. It seems to happen a lot, and you have a lack of control. In overeating, it may be something you do once in a while, or you tend to overeat, but you don't have all this compulsive, addictive behavior that you might have with a food addiction. And also, when you get into addiction, you may get into issues like some people who report food addictions actually lose work because of it. They have to stay home because they want to consume large amounts of food and they're not able to do it. And they want to stay home and just eat all the time. Or they're creating a level of tolerance around food, just like you would around a drug. So you get to a point where you can eat a certain amount, and then what happens is you need to eat more in order to satisfy yourself. So there is this, the satiation level just keeps coming up more and more. But the bottom, so that's the sense of addiction. So if you recognize that you're more in the addictive stance, then I would say try to get the help that you need to get for the addiction. Even if you go to a 12-step program and it's not a program that's directly related to food addiction, now there are OA programs which are great, but some people say that they've gotten some good results by going to an AA meeting and using, instead of using the term alcohol to deal with their addiction, they use the term food. But otherwise, it's a very similar process. So food addiction is much more of a compulsive, out of control act that is a lot of times very self-destructive in someone's life and can get them into personal and professional trouble. And the third question I wanted to bring up that I thought was great was this patient. He's here in Los Angeles, and I don't want to really mention his name because he may be someone that is associated with our weight loss center at the Kalili Center. And he says he recently had weight loss surgery, and he's wondering, does weight loss surgery cure food addiction? I think this is a great question. I would say that weight loss surgery is a great tool in helping dealing with food addiction. But if you want to be able to deal with your food issue in a multidimensional way and possibly have the best results you can possibly have, it would do you good to be able to deal with some of the psychological issues, underlying issues that caused you to get to into the situation that you were in before the surgery. It will be a great tool because you'll be able to control yourself more around the surgery, around food. But remember, there are cases where people sometimes stretch their pouch and cause them to regain their weight, or they find interesting ways to get around the surgery. I had a patient who used to talk about drinking a lot of milkshakes because she couldn't eat a lot, but milkshakes she could drink a lot, and that's the way she put back on a lot of weight. So you see, she never really dealt enough with the underlying issues that were prevalent that caused her to gain weight. So the way we approach it here at the Kalili Center is we try to look at it from a multidisciplinary point of view, and that's why we hold these support groups and offer a lot of help to our patients. We even have a men support group, which is a unique type of support group dedicated to the issues that a lot of men deal with when they are facing bariatric surgery. It's something that has been a tremendous success and something that I lead and have enjoyed leading a great deal, and would recommend anyone who's in the Los Angeles area, if you want to come to one of our support groups, feel free to do so. You can just go to the Kalili Center, to our website, and look at services, and it'll give you a calendar of all the events that we hold. So with that, I wanted to come to conclusion about our webinar. I wanted to thank everyone for coming in. There's a lot of other questions, but we're running out of time. And just to remember, the thought I want to leave you with the most is people's shame tend to get in the way of them getting the help that they need, whether it's through surgeries, psychology, a combination of all of it. And if you can find a way to deal with your shame and recognize that nobody's perfect, everybody has issues to deal with, everybody is human, and people will be very empathetic towards you. And actually, a sense of strength is about a person who's able to deal with their issues, not a person who goes in denial and feels like nothing's going on. But the more you can embrace that, the more you can deal with your shame, the more you can come to terms with who you are and get the help that you need, chances are the more successful you're going to be and ultimately live a happier and healthier life. So with that, I want to thank everyone for coming to our webinar. And we have our next webinar coming up will be on what I call the psychological stages of weight loss. I'm Dr. Gluss. Thank you again.